Good evening, everyone. I hope everyone had a great day. It was beautiful weather. My name is Tracy Bisson, and I am here with Dr. Tasha Wilson of Acupetvet.
Hi, guys.
We are going to talk to you tonight about some very interesting stuff. I can't wait to get into it. But before we do that, I just wanted to tell you that this production is coming directly from the New Hampshire Dog Walking Club. And you can see we're have a little ticker going along the bottom there. We are the Dog Walking Club is a program outreach of It Takes a Village Pet Care, of which I am the owner and founder of. And we have experts monthly like Dr. Wilson, who come in and talk to members and share information and resources and techniques. And we've been having some great talks this month, and we have more coming up as well. And what we also do through the Dog Walking Club is we work with charitable partners like Mary's Dogs. So hello to all the Mary's Dogs folks that are watching us on the Mary's Dogs Facebook page. Glad you could be with us tonight. We are supporting Mary's Dogs through creating awareness of their mission and also helping to raise funds for them over a period of 3 months. And we already have gone over the $500 mark. We're on our way to $1,000. And if you're in the club, you will see the fundraiser that we are running for them. Of course, if you're listening to this broadcast live today, they they just wrapped up their New Hampshire Gives campaign, which I heard they did really well in. So I'm glad. Thank you to all and everybody who donated to their New Hampshire Gives campaign. So tonight, as I mentioned, we're talking with Dr. Tasha Wilson from Acupetvet. How are you, Dr. Wilson?
I am doing well, thank you. I'm excited to be here.
Good to see you again.
Fun. It's fun hanging out with you guys this evening.
Awesome. Yeah, because everybody always has good questions, so we appreciate it. So tonight what we're going to be talking about is what your dog's body language says. And we're not talking about when your dog lays on its back and puts its feet in the air and its tummy's up, right, Dr. Wilson? We're getting more into like when it involves pain, correct?
That is correct. Yep. There's a lot of things your dog can show you, the way he stands or walks, that can give you an indication that he might be uncomfortable.
Okay. So specifically what Dr. Wilson will be talking about tonight is different ways to identify if your dog is uncomfortable due to pain and signs that dogs exhibit when they're in pain that you may not be aware of. So I think that's going to be extremely helpful because I think, what I know about dogs and cats even, they're so resilient when they're in pain, and usually they don't show it until it's nearer the end. And then they're in extreme pain when they actually show it. So I think, the tips you're going to give us here are going to be extremely helpful. So, and I know you have a great presentation to show us too, but before we get into that, if you want to tell us a little bit about yourself and Acupetvet, that'd be great.
Sure. So I'm Dr. Wilson. I'm a veterinarian, been a veterinarian for about 15 years. And a few years ago, I would say about 6 years ago, I decided to get certified in acupuncture. I wanted to find some other ways to help animals with their pain, and saw amazing success with acupuncture. It was wonderful to do. And I started actually learning about more things that I could do, including rehab therapy. And actually, rehab therapy is where I learned all these things I'm going to teach you. There are different postures that I wasn't even aware of as a veterinarian. So I think it's things that a lot of us don't know about, including myself. And so it was neat when I started learning this stuff, and I want to share it with you guys today.
Wonderful. So if you have any questions at all, feel free to leave a comment below as we're talking, and we will put your question up on the screen as we go through, and Dr. Wilson will answer it for you. Now, if you notice above too in the event announcement, if you want to leave a comment, you should go to streamyard.com/Facebook and give permission for us to see your name so that we can address you directly. Because we're streaming into some groups, we won't necessarily see your name unless you give that permission. So again, that is the instructions to do that are above in the event description. All right, fantastic. Well, I know, let me share the screen here because I know you have a presentation to give us here. Perfect. And I'm going to just take this off. There we go.
Okay, give me 1 second here. Bear with me.
Not a problem. I love that little face. What do you think that dog's telling us right there?
Yes, nice little body language right there.
I think he wants some food.
All right, let's see. All right, let me know. I want to make sure I am newer to the technology on this StreamYard, so let me know if there's if you guys can't see my next screen here. You guys see
Perfect.
that okay?
Yep. Looks
Perfect.
fantastic. Actually, you know what? Let me take off this top banner, Dr. Wilson, because it's hiding the top of your screen. So there we go. Perfect.
Okay, and I'm going to move something around too so I can see you guys too. So wonderful. Thank you for your patience, guys. So as Tracy was saying, a lot of times when we think about body language, we think about rolling over, getting your tummy rubbed, letting your dog letting you know how much he loves you. When you rub his bum, he shakes his bum, he's enjoying that. So we think about body language typically regarding their behavior, what they're doing, whether they're scared, like this mill dog here, maybe running around the water, enjoying themselves, or if you have a dog or you see a dog that looks a little fearful and potentially wants to bite you, you stay away. So those are the typical body languages that we think about when we talk about body language. But body language can tell us so much more. And the one thing that is so important to detect is when your animal's in pain. And there are several different observations we can make. That's not necessarily posture, so I'm going to go over that a little bit with you first. Sometimes when dogs aren't feeling good, you're going to notice a change of appetite. And many people know that. They don't eat as well. Maybe there's something wrong with their mouth, or maybe they have a tummy upset, or they just don't feel good and they don't want to eat. Energy level is also important. So there are some dogs when they really don't feel good, and usually it's when they're really sick. Like Tracy was saying, a lot of times they don't show symptoms until they're really not feeling good. They won't want to do their normal activities. In fact, when I was in the clinic, I would hear a lot of stories and have patients come in that basically would not want to get out of their crate. And when the animal doesn't want to get out of their crate and they usually want to get out in the morning to eat or go play, something's not right. And sometimes it could have been something internal, but with these dogs and many of the dogs I saw, it was related to pain. In fact, a lot of them actually had Lyme disease. And they would be so painful in their joints that they didn't want to move. So things like that can help you detect if your dog is uncomfortable or in pain. I did list vocalizing here. Most of the time, they don't vocalize. It can happen, especially when you pick up a dog. Sometimes if you hit a sore spot, they will vocalize. There are some dogs out there, and I've heard about it many times, and some of you may have pets like this where you touch them in the wrong way and they yelp out like you just hurt them, and they're really just very, very sensitive. So that can happen too. So vocalizing is a great way to tell if your animal's uncomfortable, but it doesn't always happen. One thing I want to stress that is so important is that you know your pet. There have been many times in my career where clients come in and say, my animal just looks sad. There's something with his eyes. I don't know what's going on, but he doesn't look right. And sometimes these general observations aren't there. Everything else is normal. Maybe the postures that we go over later on today is also normal. But as a pet parent, something's going on. Trust your gut on that and go see your vet. Because 9 out of 10 times, the veterinarian will see something going on and find something, even if the physical exam itself is normal. So if your animal doesn't look right, isn't acting right, don't hesitate, even if it doesn't meet this criteria, to go talk to somebody. So we're going to talk a little bit about dog postures in regards to body language. So this dog here, it looks like he's enjoying himself. It looks like he's very comfortable. His back's nice and straight. His body's elongated. He's going after that frisbee. He's probably going to be playing frisbee for hours outside. So I'm sure he's fine, right? Not always. And if we have dogs that have occasional limp, we'll know that when they have an opportunity to go play with their best friend next door, they're going to play, and they're going to play hard, and they're going to forget that they really should be playing at all. If some of you are marathon runners, I have friends that they would be told by their doctor not to go running. They'd be told to take a break, 6 months off, and they won't stop. Same thing with our pets. They will just keep on going. So even though your dog goes out and plays like normal, doesn't always mean he's not uncomfortable. So we're going to talk about these dogs here in this picture. There's a golden retriever on the top left. looks like a Rhodesian Ridgeback on the right, and then a Lab and a little Jack Russell in the corner there. So we're going to talk specifically about their backs, where their backs are in relationship to the rest of the body, their front legs, and their back legs. And each slide coming next up will show specifics on what I'm looking at. If you have any questions, feel free to just go ahead and comment during these presentations. I will slow down, so you can definitely don't hesitate to ask questions, because there's a lot of information here, and it's different information, I'm sure, for most of you.
And Dr. Wilson, I have to ask, is that sweet little Mickey?
Yes.
Oh,
that's sweet little Mickey.
I love that picture. That's
I
great.
love Mickey.
Yeah.
Yeah, he was. Yep. And he'll be in these next few slides here. So the golden retriever, as you see, I drew like a little black line there, and that black line indicates how straight the back of this dog is. So I usually go from the back of the neck all the way back to the base of the tail. That is quite straight. The reason I do this, I like to take an imaginary line, just say, okay, is their back elevated at all? A lot of times if a dog's back is elevated, there is potentially some back pain or something going on in their back end that's causing that elevation to happen. Having said that, back pain can also indicate abdominal pain. So if the kidneys are hurting or the stomach's hurting, sometimes they have that back-shaped curved up and not flat. So there is other reasons why that can happen. But again, we're talking about having discomfort. So that back being hunched in any way can describe some discomfort. So over here on those the Ridgeback, again, I drew a line, and as you can see, this is very straight as well. So these two dogs' backs are very straight. I don't see any abnormalities in that at all. When I go down to the Lab here, again, I go to the end of the neck all the way to the base of the tail. And where that arrow points, you can see a little curvature right there. Now, looking at this Lab, he might be a little bit overweight. So I might feel that little curve and feel fat pocket or a little bit of extra cuddle spots for him. The other thing that it could be is that if I take a feel that would be his muscles and his spine in that area. And that would indicate that his spine is actually curving a little bit, indicating some pain. Little Mickey here. Mickey, as you can tell, I have the line showing where the back should be if it was straight. And his back was curved. And the reason that is for multiple different reasons, but he did have some discomfort along his back. In fact, if you go ahead and massage a lot of these dogs that have a curved back, they're very, very sensitive and their muscles are very tight. And his was, and he had some discomfort along his back. The other reason sometimes they curve like this is, as you can see right here, his legs are kind of tucked a little bit under, and that was how he was able to actually get around. In order to be in a comfortable position for him, he had to curve his back up a little bit so his legs would be in a good position for him to walk. A lot of these dogs, especially older dogs, will stand a certain way to relieve themselves from the pain. So if their joints, if they can't bend their knees, let's say like Mickey here, let's say he can't bend his knees, he's going to stand more straight and he's going to put himself in a position where he can still walk as well as he could without bending his knees. When that happens, they end up getting a lot of muscle tension, and their body kind of remembers that's how they should be standing. So it's really hard to get them to get straight again. One of the things that you can do is, if your animal is uncomfortable and has adapted to a new way of standing to make himself more comfortable, is get that pain level under control so he feels a little bit better, and then get some rehab done or have a physical therapist teach you how to do stretches and massages to kind of loosen up those muscles and get them to relax a little bit more so they can get in a more normal position. Any questions about that? Yeah, I don't see any.
Nope.
Don't hesitate.
Nothing yet.
Okay.
Monitoring for you.
All right, thank you. So the other thing we look at is the legs. So I look at the front legs and the back legs. Again, use an invisible line from the shoulders all the way down to the ground, from the hip all the way down to the toes. And this is nice and straight. So that would indicate to me that everything looks good here posture-wise in this dog. This golden retriever is perfect. The best dog ever right there. It doesn't happen that often. I will tell you, if your dog is any type of dog, your dog is going to go out and your dog is going to play rough and he is going to get some sores periodically. And his conformation isn't going to be perfect all the time. But this picture is perfect. So when I compare it to the other dogs, this one here, again, shoulder down to the toes, nice and straight. And this one, down to the toes, you can see there's a little bit of a tilt here with the hips, and then it comes down and goes a little bit straight. Now, that might indicate that this dog might be having hip issues, and he can't make his hips go in a different direction and rotate it differently to make it a straight leg. So he kind of tucks it under a little bit to make it more comfortable. Now, having said that, there are some dogs out there that have certain conformations. And German Shepherds, for example, a lot of times their legs will actually be kind of from the hip here out like this. And that's a conformational thing with certain breeds. So that's something to think about too, depending on your breed. And you can always go on the AKC site and take a look at what the normal standard is. Having said that, there are some breed standards that, yes, that is accurate for that dog, but there might be still some discomfort from those shapes. So that's something you can definitely touch base about with your vet too. The other thing about this dog is this dog looks like he's looking at something, almost like he's ready to go for a little run. And when that happens, a lot of times they get ready and prepared, and their back legs or their front legs might shift accordingly to what their next step is going to do. So if he was going to take off, he would be ready to run and start ready to bend his knees. So the other thing to look at when you're looking at your dog, does he always stand in that position? Like if you're looking at your dog outside and he's looking at something, he's in a stance and he's nice and low down to the ground, he might not always stand that way. So you always want to kind of take a look at him when he's outside, when he's just standing, not doing anything, maybe standing waiting to get food in the morning, and see if he still has that same posture all the time. And that will help you know if that's really coincidental or if there is something going on. And then with this lab here, you can see that there is the hip going down to the leg. I'm just going to move my screen just a little bit there. Hip going down to the leg. You can see that it's curved a little bit in the front here. It's not nice and straight like here. His hip is a little bit curved in the front. Now that could indicate some possible issues. So if I saw this dog, I'd say, well, let me just take a feel of the hip and see if he can move his hips really well. The other thing about this dog that makes me think there might be something going on with the back end, besides the curved back and the hip area here, is his front legs. See how that line goes straight down? And you can tell that the leg just isn't as forward as it should be. A lot of times this happens because they're actually shifting their weight forward. So he's actually leaning forward, taking some of the weight off their back end. And that makes those legs do that. So legs doesn't stay straight under them. The other thing that can happen when they do this is if there is any shoulder pain, sometimes they won't put their legs straight because it hurts too much to do that.
So Dr. Wilson, is that an example of a patient that you have had, and was the dog obese, or were there other issues that the obesity led to? And maybe you're addressing this later on. I don't mean to jump the gun.
Nope. I hate to say this. This was a photo I found online.
Oh, I wasn't sure because I knew Mickey was a client. So
yep, I did. I found this photo, gosh, weeks ago, and I just really liked it because it's not straightforward. It's one of those things that there may be something going on. But then when you look more, I always look at the whole picture of an animal and not just like one little area. So when I see his front legs, it just tells me there's something not right. He is uncomfortable just because of what he's doing those front legs.
Yeah, it really looks like he's compensating for something with his stance.
Yes. Yeah. Like he's just shifting his head forward. And when they do that, I mean, if you can imagine being on all fours, and if I had more of a video camera, I'd get on all fours and show you guys. When you're doing almost like a yoga stance and you lean forward, you're going to have more of that weight shifting forward. And that's what's happening with this dog. And again, his shoulders are not doing what they should be doing because of that. And then here, the front legs look perfect in this picture. But as you see in the back legs, it's definitely tucked more under. So his hips are tucked. So if I wanted to actually get his hips to kind of push out and go a little straight, it's going to be painful for him. And his knees are also very, very straight. So it'd be really hard for him to bend his knees and stand in a normal position like this golden. So when we think of postures, another thing I think of is how the dog's legs are standing in relationship to one another. This is actually a patient. It's my dog, and it is a patient of mine as well. Poor guy, he gets acupuncture regularly because he lives with me, and I don't know. He gets used to it. He actually enjoys it, but it's funny because I think he wants to play, and I'm like, nope, acupuncture time. But as you see here, I took 2 pictures because I wanted to show and stress the importance of making sure the posture stays the same regularly. Because you might catch a dog standing a certain way one time, but then you never catch him standing that way again. But Jenkins here, you can tell if you look at his back legs, his left leg is more forward than his right leg. And in this picture, you see the same thing. And that was his typical stance. When he stood like this, he actually was shifting most of his weight on the left side. So the reason why he stood like this was because he wanted more weight on this leg. And in fact, and this is a trick, something you guys can do at home, if I went up behind him and I actually picked up that leg with just one hand, so I would actually go on my knees, pick up that leg with one hand, and then compare it to when I pick up the other leg, I could easily pick up the right leg without any problem. He was not putting weight on that leg. The left leg, it was hard. It was a lot of weight on that leg. And that's a trick that you guys can do. A lot of times we see our dog and we're like, gosh, I think he's limping in his back leg, but I just can't tell. I don't know if it's the left or the right. And even in veterinary clinics, you have animals come in and they're limping. We can't figure out what's going on. Sometimes the x-rays are perfect. One of the tricks is feel those back legs. Sometimes you'll actually feel the muscles maybe a little bit thinner on one leg than the other. You can even take measurements to actually test that. That's something a lot of times rehab therapists will do, but you could do that at home as well if you're suspicious. And then you lift up that leg and you lift up the other leg, and one at a time, not both. That would be not nice. And then you go ahead and see which one comes up easier, and you repeat it because sometimes they do shift a little bit generally. Dogs will normally do that, but a lot of times you can easily tell which leg is bothering him by that trick.
Well, Dr. Wilson, this might be a great time to segue and mention that we do have our official club party coming up on the 24th. Yes. And I know at that party you have agreed to take a look at pet owners' pictures and videos and help evaluate if there's any pain at all indicated in that. And I know we're going to be posting in the group and having a stream of, or a timeline for where people can post their photos and their videos. But do you want to speak to that at all, what you're looking for in these pictures and videos?
Absolutely. And I'm really excited about this. I think it's so important. And I definitely want to, if you guys think that your animals are uncomfortable, I definitely want to help you out. So basically a picture like this, a picture just like the ones we just looked at with the dogs, just them standing there. They don't have to be up in the air like this one here, but standing there on the floor, just standing still. You want to send a picture and say, hey, how does this look? Feel free to do that. I do have some videos coming up too that I can show you. Short videos. It literally can be 15 seconds long. It can be really, really short. Sometimes just walking, you can see limping. Running, you can see limping. A lot of times if an animal is being walked and then turned, so turn to the right, walk a little bit, turn to the left, you might pick up a limp there. So you can definitely send me some videos and I'll take a look at that. Sometimes if there's a video there that if it's too fast, sometimes I can't see if there's a limp. A limp. So one thing we can do is I can somehow get that from you and do it in slow motion. Sometimes I see things better a little bit slow motion. But I'm very excited about that. I want you guys definitely to post some things, and then we'll talk about them during the party.
That's awesome. That's going to be really helpful. So again, after this pop-up talk, I will create a timeline in the dog walking club where you can post those photos and those videos. You have to be a member of the dog walking club, obviously, to post in the timeline stream that I'm going to create. But membership is free and the information is running across the bottom of the screen there for you.
And definitely become a member. It's a great club, and they have experts talking every month. So I'm a member. And I've learned a lot.
Well, Dr. Wilson, we do have a question here before we move on, if this is good for you.
Yeah.
So absolutely. Ray asks, we took our dog into water last year, and after that, she had a limp tail. What would have caused that, and any preventative measures you would recommend?
So that's a great question. They can sprain their tail, and it's usually because they're just playing so much in the water. Preventative measures, I think that would be hard, just because it's, swimming in water is more uncontrolled. So it's not like you can quickly stop them. If you had like an underwater treadmill or something like that, which most of us don't have, but that'd be one thing. But being in an uncontrolled area like that would be hard to prevent unless you limit the amount of time. So especially if it happened a lot, then you might want to say, instead of 20 minutes, let's do 10 minutes out here. And that generally is what it is. Sometimes tick diseases can cause limp tails too. So if it's something that lasts longer than 24 hours and it's really painful, you'd see your vet and just have it checked out.
Great, thank you.
You're welcome. So this is just another example of an older dog that has a curved spine. The hips are a little bit tucked under like that, and the legs aren't straight. Like you can tell, they're really, really bent. The front legs, instead of being straight down, so you can imagine an invisible line right there, the legs are more, again, pulled back. So this dog was uncomfortable, and just to show you, after doing some pain management treatment on this dog, you can see the after. And I wanted you to see this just to show you, like once the pain level is controlled and we do stretches and massages, that back can go back to a nice straight back again. The legs, even though they're not 100% straight down, you can tell they're definitely improved. And the front legs are not 100% improved, because it was more like this, but you can tell they're getting more forward. And that's just from pain level being controlled and doing some massages and stretches.
So Dr. Wilson, and maybe this is coming up, but how do you decide when you're determining what level or what type of pain the dog is in, what type of therapy to use? You know, acupuncture versus cold laser versus massage?
Yeah, that's a great question. So with anything that has to do with pain related to the muscles, back, or even some orthopedic bone surgeries, things like that, I recommend what we call the rehab, full rehab, which includes acupuncture and cold laser therapy, massages, and stretches. And then when their pain level gets controlled, we actually do some exercises too. So you can do some exercise at home to keep their body moving in a normal motion. Because a lot of times when they're stiff like that, they're not moving as well as they should. But once we loosen things up, we want them to go back to remind their body what it feels like again to move the way they should. So the exercises help with that. If I had an animal where, let's say we decide just to do one treatment, acupuncture or laser therapy. Laser therapy I use a lot if there's a lot of muscle tension. I like to just kind of loosen up the muscle tension with the laser. The laser is probably about that. Well, I don't know if you can, let me make sure you guys can see my circle there. It's probably about that wide, and that's much light that actually goes on the skin, and it gets absorbed through the muscle and the skin and helps decrease inflammation. So I can put that right on the muscle and loosen it up. So with a dog, for example, that's leaning forward, a lot of times if I put my hands on them, I can tell those front legs are really, really tight. And I would use a laser on that. And then the acupuncture points, I can target acupuncture points with the laser therapy as well. But if there's a lot of tension, I like to use the acupuncture point specifically with the needles to help loosen things up too and help out with the pain response.
Well, I know last week in our talk, you were talking about how the dogs once they've had this, once or twice, they seem very relaxed, and they realize that this method, this therapy you're using is helping them. And
Yeah.
there seems to be a calmness with them.
Absolutely. And in fact, it just happened again last week. It was a new patient. Because of COVID right now, clients aren't coming in. And at first, it's hard for a dog to come into a building with a stranger. And so I recognize that. And I take my time with them. And sometimes I have, like this particular dog, I actually put the bed right next to the door so he could see the owner through the door, and get his treatment done. But 2 treatments into it, he knew exactly what was going on, and he ran right in and sat on the bed that was not by the door and just laid there waiting for us to do the treatment. So it was
Oh,
neat to see because he finally realized, hey, this is a safe place and I'm feeling better
that's
after being
awesome.
here.
I
It was
love
really
that.
neat. Yeah, it was really neat. I got some pictures for the owner, and the owner was thrilled, and the dog looked so happy.
Well, and Dr. Wilson, Jennifer is back with us this week, which I'm psyched
Oh,
about.
yes.
Just to give everybody a little bit of history, Jennifer was with us last week, and her dog needed surgery, and she did talk to Dr. Wilson offline. So this week she's saying, Champ
Oh,
with Scooby, Champ of X Scooby had the TPLO surgery today. He is doing okay after 8 weeks of healing. What do you recommend? We talked last week.
that's great. Well, I'm really glad. That was great that you were able to get the surgery done so quickly.
Yeah.
Um, And so if he had the surgery today, I'm thinking he probably is staying overnight. That usually happens. And so during the first 8 weeks, it's really important to get pain level control. So your surgeon will talk to you a little bit about that. They usually will recommend icing the area frequently to help out with inflammation and also helps out with the swelling. I highly recommend that. They'll talk to you about a few exercises that you can do as well, including range of motion, where you move the leg in a normal pattern. Um, to a point where they're comfortable. So they'll go over that with you at the discharge. So you know what to do regarding those exercises. There's not much more at home you do for the first 2 weeks. Some things to think about though is the pain control. I see a lot of patients, usually sometimes even right after surgery, just starting the acupuncture, starting the laser therapy, helping you with the exercises that the orthopedic surgeon recommended. And as time goes by, after that 2 weeks, we're able to do more with your dog. And so then we do exercises, and I can teach you some things that you can do at home that will not be a hinder to the surgery or cause any problems with the surgery, but will stimulate your dog because it's going to be really hard for your dog to stay still for 8 weeks until they do a recheck X-ray. So great question, and I hope that answered it. I hope that gave you some feedback. They're going to give you pain medication too to make sure they're comfortable, and give them lots of loving. That's great. That's great medicine for the recovery.
Yeah, and Jennifer says he is home now, and I guess he is a tripod
Okay.
dog, and the knee replacement was done on his only remaining rear leg.
Okay. Okay. Yeah, definitely something to think about. Helping out the pain control, massaging would be really good because he's probably going to have a lot of tension along his lower back and his neck. So that's something that your vet can show you, or you can always give me a call and I can do assessment for you too and show you as well.
Great. Congratulations, Jennifer. I'm glad you're on the other side now. You're
Yes.
starting the healing.
And you'll be amazed how quickly they do, how well they do right after surgery. It's a beautiful thing to see them not in as much pain as before.
Yeah.
Thanks for the questions, guys. So we're just going to touch upon limping, because limping sometimes is hard to tell. As I mentioned, sometimes we know our animal's not walking right, but we really don't know why. So like I said, you can always try that trick. That trick generally works better for the back end. The front end, you start moving the front legs and they just move with you. They think you want to play. But the back legs, sometimes you can easily do that. When it comes to limping in the front end, I'm actually going to show you a video that will help you figure that out, because the front ends can be hard, but one thing that happens with the front end is the head likes to bob when an animal is limping in the front. And the reason that is a dog's front end is heavier than the back end. And when they are having, if they have a sore leg, let's say it's a right leg that's really sore, and they put that leg down on the ground, so they're going to walk, they're going to put weight on that leg. And if their head goes down when they put weight on that leg, they're also putting the weight of their head on that hurt leg. And they don't want to do that. So what they do instead is they lift their head up. So anytime an animal has a hurt leg, their head goes up because that head itself weighs extra, and they don't want that on that leg. Does that make sense?
Yeah.
I'll show you a video too, and I'll go through that a little bit more. The back end sometimes can be a little bit harder to tell. Sometimes it is a posture thing. Sometimes, like with Jenkins, he put his leg forward, a little bit back. A lot of times they don't move their leg as well, so they look stiff. If you have a knee injury, a lot of times they won't bend their knee, and so you might see that when they walk. On occasion, and honestly, it doesn't happen often. On occasion, when you have a dog that has a real, let's say a right side that really hurts a lot, their tail might shift to the left side because they don't want that extra weight of their tail on that right side. Same thing with the head. They shift over any extra weight they can. I don't see that often, but it can happen. I mentioned back pain because sometimes you can get limping with back pain. So I don't want you to think that just because he looks like he's limping in his right leg, front leg, it absolutely says there's a right leg issue, because sometimes it can be the top of your back or the neck for a dog. So this is Larry, and I'm gonna try to slow this down. I want you to watch his head bopping, and I'm gonna kind of help you through this. You can see his head go down, and when his head goes down, another leg goes down. So I'm gonna see if I can slow this down. So as you can see, his head goes down, it goes back up, down, and then up.
Oh, poor guy.
And then yeah, he's doing really well now, but he was really sore. This is actually the first time I saw him. And as you can see right there, you can see his head goes down when that left foot is down, which means he puts his head up when his right foot goes down. His right foot is the one that hurts because he doesn't want his head adding extra weight when he steps on it. So I'm gonna let you see the full video here.
Now, is he panting too? I mean, it really looks like he's working at that.
Yes. Yep.
Yeah.
He's panting. And you can see too in his back, he definitely, we talked about the hips and how the hips can be tucked under. He also has on his back legs. So he has some back leg issues as well. But primarily right now, the pain is his front. And you can see again, that head just bopping down. So if you ever see a head bopping back and forth, there's something going on in the front leg. Now after treatment, after a few weeks, this is what he looks like. So this is his normal gait. And there's still a slight limp there, but so much better. I mean, if you see that, you can tell there's no head bobbing like there was. I mean, it's very
How old
straight.
is Larry?
Larry now is 16.
Wow.
He turned 16, March or April.
What? That's fantastic.
Yes, he is. Oh, and he's so much fun.
Wow.
He lets me. I do massages on him, and actually, I will take these legs right here, and I'll stretch them out, and he loves it. He didn't love it at first. He was like, he's got I love his attitude. He's kind of like, okay, you're here, do what you need to do. But I know he loves me. But yeah, he's a great dog, and he's doing really well with that limp. So here's another video, and I kind of gave it away a little bit before. Pause that. This is Jenkins. So as we talked about, Jenkins had a hind end issue, and this is a little bit harder to see. It is from the back. A lot of times, if you want hind end issue, it's good to get a side view so you can see it a little bit better. But you're going to be able to see that when he walks, his right side, it almost doesn't bend as much as the left side. And it also doesn't last on the ground as long. So I'm gonna play that for you here. It's like, I would say it's stiff. And I'll repeat it. I'm gonna play it one more time. And actually, I can go a little bit slower. I like this little button.
It's got like that catwalk swing.
Yes, actually, yes. Yeah. So there is his bad leg going out, and then it's going forward. And that one bends more. And actually, his tail, if you look at his tail, he definitely swings a lot more on the other side on the left. He doesn't bend that knee, especially right there. He keeps it. Do you see how it keeps it straight It's hard to tell.
Yeah.
Back legs are really hard to tell.
Like he's
Sometimes, like I said,
on the floor a little bit even.
yes, and that can definitely happen. Sometimes you can see that they toe touch and they show you other signs besides just this. And I will tell you, this dog, when he really hurt himself the first time, he was not putting as much weight on there. And the other clue too is when he sits, see that leg, how it splays out?
Yep.
He doesn't want to tuck it under. And that's because it hurts. He doesn't want to fully bend it. He doesn't want to keep it straight. And so in order to make it more comfortable for him, he sits like this. When ideally, he should be sitting like this picture here, where it's tucked under him like a little square. There are some dogs, I will say, that just have what we call lazy sits. So some dogs always sit like that and it doesn't mean anything's going on. But if your dog starts sitting like that and never has before or shows any other signs of pain, you definitely want to touch base with that.
Well, now Jenkins is a senior dog as well, right?
He actually is 6. He is not.
Oh, 6. Oh, okay.
Yeah, he hurt his knee a year and a half ago. So at 5 years old, in April last year, he actually got surgery on his knee for the cruciate that we were just talking about, for TPL surgery.
Yep.
Yeah. So he's still a baby. He sometimes he doesn't want to move around like a baby should, but other times he acts like a 1-year-old, and I wish he was a little bit older. So some other things to look for: hesitation on stairs, hesitation for jumping. I want to mention cats right here too. I know we're talking about dogs, but if you guys have any cats won't show you symptoms of pain, rarely ever. But 80% of cats older than 8 years old have some arthritis. And typically the signs you see is them trying to go up and jump, and they kind of hesitate, and then finally they make the jump. That should give you a sign that there might be something going on. And they might not need pain medication. Cats actually are very sensitive to pain medication, so there's not many options. But if you ever see that, I'd recommend talking to your vet about some joint supplements for your cat. Because that's really the only symptom you see is the decreased jumping in cats for the most part. And then dogs not walking as long as usual. Let's say they typically like their 10-15 minute walk. They do 5, they turn around. Sometimes they just sit down. That would be a time for you to say, oh, something's not right. I chuckle because I remember when this whole quarantine thing happened, there was all these Facebook posts, and there was one guy that walked his dog, and his dog just kind of laid there on the ground, didn't want to go for any more walks, because I swear the guy was just taking him for walks like every 5 minutes. And he literally left his dog, and of course it was a video, so he really didn't leave his dog, but left his dog just laying there on the ground. As he's like, Dad, I'm not going for any more walks.
I'm done.
Exactly. So that's the presentation I have for you guys. I hope it was helpful.
That was fantastic. I mean, I particularly like the before and after videos. I think that's really helpful because, I think most pet owners have a really good sense of what is normal with their dogs and what is not. But you gave some really good tips in regards to certain things to look at that we wouldn't necessarily think of. And I think too, for me, like I have one dog that is 4, and she's, she gets a lot of exercise. They both get a lot of exercise, but she runs more and she, acts her age. And then I have one that is 11, and she's slightly overweight. I think, with the pandemic and with everybody kind of buckling down and trying to figure out what happens next with their businesses, we slipped a little bit on the walks, so, I'm going to take a closer look at her, and she's got a lot of fur. So I have to take a real close look at her based on the recommendations that you gave to see if there's potentially, any overcompensation there for being a little bit bigger. But yeah, extremely helpful.
Good. I'm glad. And feel free to send more questions too on the webpage to the Dog Walking Club Facebook page. And I'll keep an eye out for videos too, and some pictures and comment too, to help you guys out.
Yeah, that'll be very helpful. And like I said, after this talk, I will post that timeline so people can put their photos and videos if you'd like Dr. Wilson to take a look at what you might think might be some pain that your dog's experiencing, and she can evaluate that for you. And then she'll talk about it not only in the timeline, but at the party on the 24th. So I know too, if folks want additional information about you, Dr. Wilson, where's the best place to get that?
Yeah, you can go to our website, acupetvet.net. Feel free to check out our Facebook page too. We actually are celebrating our, fourth year anniversary.
Happy anniversary.
And so, thank you. I'm very excited. And so we're having a lot of some raffle stuff happening at the end of the month there, but there's some great videos and photos of animals getting acupuncture, so you can kind of take a look at that as well. And you can email us at info@acupetvet.net.
And can you also tell us about this special offer that you're running for members for the month of June?
Absolutely. So I usually do what we call an acupuncture and laser bundle, which is a consult where I basically evaluate your pet, check their muscles, see if there's any muscle tension, look at posture, kind of give you an idea of what might be going on with your pet, and then we treat with acupuncture and laser therapy during that session and relieve any tension that might be going on. The other thing that this bundle includes is a nutritional consult and a supplement consult. So we'll talk about your diet and supplements and see if we might need to tweak things based on what I see. That generally is for $150, but you guys would get a $50 savings if you did it this month.
Yeah, that's a fantastic deal. And I have to ask too, does that extend to cats? Because you mentioned cats. Can members use that for cats too? Okay.
Absolutely. Yeah, absolutely.
And so they should just go to your website to reach you, or just email info@acupetvet.net. That's the best way.
Yes, absolutely. When you go to the website, you can do a contact form. If that's easier for you, you can do that, or just go ahead and send us an email and we'll get back to you and talk about scheduling something.
Excellent. Perfect. Well, thank you very much, everybody, for your questions. And thank you, Dr. Wilson, for your wonderful advice as usual. I know we have you coming up next Wednesday on geriatrics in dogs, which will be very interesting. And I just wanted to kind of give a preview for that too, because I think you have a very sensitive topic that you will potentially be talking about next week too, in regards to when is it time to make that final decision, to lay your pet to rest. And I think, that'll be a tough conversation, but I think especially when we're talking about older pets and we're talking about pain, you have to know when is the right time to make that decision. So I highly encourage everyone to stay tuned for next Wednesday. Join us live, ask your questions, or catch us on the replay. But yeah, that'll be a very important conversation. So looking forward to that as well. So thank you for your time. Very much appreciate everything that you share with us. And
wonderful. I love being here. It's fun. And I really like all the questions. So thank you very much.
Awesome. Then we will be talking with you next Wednesday night.
Wonderful.
All right, everybody. Have a great evening.
Good
Thanks
night.
for joining us.